Welcome. My name is Bernard Rubenstein with Franchise Benefit Solutions. I want to welcome the employees of the Joint Chiropractic for our 2024-2025 benefits enrollment. Our agenda today includes your power of choice, how your benefits program works, your eligibility and enrollment. We'll review your 2024 and 2025 benefits, and then how to enroll. The Joint Chiropractic offers a customized benefits package enabling you to design your own plan, to choose benefits to fit your own needs and your budget. The Joint Chiropractic has set up a contribution level. The rest is up to you. You decide what you want and what you can afford to spend. Through payroll deduction, choose from 3 health plans: dental, vision, telemedicine, voluntary life, accident, critical illness, hospital indemnity, short-term disability. The contributions you make towards your employee benefit plan are deducted on a pre-tax basis. This automatically reduces the net cost of these benefits to you by lowering your taxes and increasing your spendable income. Eligibility. So who can enroll? If you're an employee working at least 30 hours a week, you can enroll. Your legal spouse or registered domestic partner, and children under the age of 26. When can you enroll? You can enroll within 60 days of your date of hire. So if you get hired today, that means you can enroll with effective date of November 1st. You can enroll during annual open enrollment. And then also within 31 days of a qualifying event. Now, a qualifying event could mean anything that has to do with a change of your life, which would include marriage, divorce, change of address, anything that affects your daily life could be a qualifying event. So let's take a look at your benefits, flowchart of your benefits. Your health insurance is through SBMA, which is PHCS multi-plan. Dental is through MedLife. Vision is through VSP. Life insurance is through MetLife. Telemedicine is through Recurrent Health. Accident, critical illness, hospital indemnity, and disability, short-term disability, is through MetLife. Your health plan options. You have 3 choices. Option 1 is Elite Care MEC plan, which includes physicals covered at 100%, office visits for physicians and specialists or primary care physician specialists, 15 copay, urgent care, 50 copay, outpatient diagnostic tests, lab and x-ray, $50 copay, and prescriptions, generic, $15 under tier 1, tier 2, $30 copay, and tier 3, a $50 copay. The plan does not cover inpatient, outpatient, or emergency. However, we'll be covering a hospital indemnity plan, which you could add as a package. And this would cover services for inpatient, outpatient, and some diagnostic testing. It is not a plan for a catastrophic type of condition. It is paid to you as the employee and not to the provider. Option 2 and 3 are similar. They're more of a major medical plan. Option 2 is a premium minimum value plan, whereas you do not need a referral from your primary care to receive treatment in network or out of network, so you can visit any provider you want. There is no annual deductible. Covered services include routine physicals, covered 100%. Office visit for primary care physician specialists, 15 copay. Urgent care, 50 copay. Outpatient diagnostic lab and x-ray, 50 copay. Diagnostic testing for MRI, CT, and PET exams is a 350 copay, 2 visits per year. Outpatient surgery is also a 350 copay, 1 visit per year. Inpatient hospital stay is a 500 copay, 7 days covered per year. And emergency room is a $500 copay, 1 visit per year. Prescriptions, generic $10 copay, brand $50 copay, and non-formulary brand 75 copay. You'll notice asterisks next to the some of the services, and what this means is as long as the hospital or the facility accepts Medicare, then they will accept your healthcare plan. Option 3 is similar to option 2. However, you'll notice that the diagnostic testing for MRI, CT, and PET exams allow you to have 3 visits per year rather than 2 visits. Outpatient, 2 visits per year rather than 1 visit per year for option 2. And emergency, inpatient hospital stay allows you 14 days per year, while the option 2 is 7 days. And then emergency care, both option 2 and 3 is a $500 copay, 1 visit per year. Prescriptions are the same for option 2 and 3. Again, similar to a major medical plan. However, there are limited numbers of days that the plan will cover. And if your hospital or facility accepts Medicare, then they will accept your plan here. You have 2 options for dental. Option 1 and option 2 are similar. The only difference is that option 1, the benefit maximum is $1,000, while option 2, the benefit maximum is $2,000. Preventative services are covered 100% for both options. Basic service cover 80% for both options. Major services are covered at 50% for both options. Orthodontia for option 1 covers 50% up to $1,000 lifetime, while option 2 is up to $2,000 lifetime. So again, the difference between option 1 and option 2 is $1,000 for option 1 benefit maximum, while option 2 is $2,000 benefit maximum. Vision, you also have 2 options. Option 1, eye exams at $10 copay once every 12 months, while option 2 is the same as option 1, $10 copay once every 12 months. Glasses, option 1, $25 copay every 24 months or 2 years, while option 2 is also a $25 copay, but it is once every 12 months or once a year. So again, eye exams, both plans have the $10 copay once every 12 months. Glasses, option 1 is a $25 copay every 24 months or 2 years, while option 2 is a $25 copay once every 12 months or once a year. The plan also includes visiting. You can visit retail chain providers such as Costco, VisionWorks, and Sam's Club, along with your ophthalmologist or optometrist. Additional supplemental plans that you can choose from: life insurance for yourself, the employee. You can select up to $150,000 or 5 times your annual salary. Spouse, you can select up to $50,000 or 50% of your amount that you selected as an employee. Dependent children, maximum is $10,000, increments of $2,000. evidence of insurability. If you enroll when you're first eligible, you do not have to answer any health questions. However, if you decide you want life insurance on the second or future years, you would have to answer a health questionnaire. Telemedicine, if you happen to select one of the healthcare options, you do not need the telemedicine because the medical plan includes a telemedicine program. However, if you decide you only want the telemedicine, let's say you're at work and you are feeling sick and you cannot visit the doctor, this is a good plan for you. So the next time you're sick, you would call the doctor, give them your symptoms, they'll give you a diagnosis, and they'll even call in a prescription for you. Unlimited use for all family members. So let's say you're sick with a cold, flu, allergies, bronchitis, sinus, ear infection, or much more. Call the doctor, give them your symptoms, and they'll give you a diagnosis. I mentioned before about the healthcare MEC plan, whereas it doesn't cover inpatient, outpatient, and emergency. You could package the hospital indemnity plan with the MEC plan. Benefits cover both injuries and sickness. You have two options. Benefits are paid for inpatient and outpatient medical treatment received in a hospital, emergency room, and physician's office. Includes routine childbirth and complications of pregnancy. Additional benefits include surgery, anesthesia, major diagnostic exams, rehab, lodging, and much more. Again, this benefit is paid to you and not the provider, and you can package it with the MEC plan, healthcare plan. You can also choose an accident plan. Plan covers accidental injuries regardless of any other insurance. The benefit, again, is paid to you and not the provider. Benefits are paid for inpatient and outpatient. Covers more than 50 benefits, including hospital admission, hospital confinement, ambulance, emergency room treatment, physical therapy. In addition to the benefits, it'll pay you a lump sum for fractures and dislocations. So, and it covers more than 50 benefits for inpatient and outpatient treatment, and then also pays a lump sum for fractures and dislocations. Critical illness pays a lump sum upon diagnosis of a critical illness. Includes more than 20 different critical illnesses, such as cancer, heart attack, kidney failure, major organ transplant, Alzheimer's disease, Parkinson's, and multiple sclerosis. You can choose from $10,000 or $20,000 benefit amount and include your spouse and dependent children. And finally, short-term disability. You have a choice of selecting this benefit. The maximum weekly benefit is 60% of your pre-disability earnings, not to exceed $1,500 per week. Benefits begin after the 14-day accident, 14-day sickness. Basically, it'll begin on the 15th day. Benefit duration is up to 26 weeks. So let's talk about enrolling. Once you receive a link from us, even though the screen says employer, you will receive a link from our office, from Franchise Benefit Solutions, to access your web enrollment. You would complete the registration by creating password for your account, verify your personal information, add any dependent information, and then you would begin the enrollment process. Now, you will have to go through each plan and either select enrollment or waiving. So you either enroll or you waived each coverage. Now, remember, you do have to go through each plan and select either enroll or waive. Then you continue until the enrollment's complete. and then you will be able to e-sign your enrollment form. Now, again, if you do not complete each plan by selecting enrollment or waiving, then you will not be allowed to e-sign your enrollment. Deadline is September 20th, 2024. Again, so you will receive a link from us, and the deadline to enroll is September 20th. If you have any questions, please refer to your management team. You can also reach us at 1-800-536-2230, extension 125. Again, I want to thank you for participating, for viewing our benefits open enrollment. Deadline is September 20th. Thank you and have a good day.